I want to focus on colonial medicine and America's own colonial holdings. In 1898, the United States declared war on Spain and invaded Cuba and the Philippines. Following several months of sea and land battles, the Spanish sued for peace and ceded control of Cuba, the Philippines, Puerto Rico, and Guam to the United States in the Treaty of Paris. The United States had overnight become a tropical colonial power. Yellow fever was endemic in Cuba. In fact, the invasion of Cuba was stimulated in part by the belief that Cuba was an epicenter for epidemics of yellow fever that spread periodically through trade to the southern United States. To prevent yellow fever in New Orleans or Charleston, it was necessary to eliminate it in Cuba. Yellow fever also decimated US troops who landed in Cuba, like the one shown in this picture. If the invasion was to be successful, yellow fever had to be put under control. Responsibility for the elimination of yellow fever in Cuba quickly fell to Colonel William Crawford Gorgas. The Army sent Gorgas to command a hospital for yellow fever patients in Cuba in 1898. The following year, he was appointed Chief Sanitary Officer of Havana. Gorgas organized a military-style campaign against the Aedes aegypti mosquito that research conducted in Cuba by American and Cuban physicians had identified as the insect responsible for the transmission of yellow fever. Gorgas ordered his sanitation officers to attack the mosquitoes on two fronts, fumigating the houses of yellow fever patients and those of their neighbors to kill any mosquitoes that may have been infected by the patient, and the elimination of mosquito larvae by screening, covering, and oiling open water sources. While many Cubans objected to the intrusive measures initiated by Gorgas, especially because most Cubans had been exposed to the disease in childhood and were immune to it, nonetheless, the yellow fever campaign in Cuba was successful in eliminating yellow fever within a year. Gorgas subsequently repeated his Havana success, eliminating yellow fever and greatly reducing malaria in Panama, making possible the completion of the Panama Canal. A key to Gorgas's success was his administrative organization, but also his ability to control the urban spaces in which the Aedes aegypti bred, enforcing regulations aimed at eliminating breeding sites and fining those who disobeyed sanitary regulations. Colonial authority made disease elimination campaigns possible. This was a lesson that one of his assistants from Havana discovered when he attempted unsuccessfully to apply the same control measures in Laredo, Texas, without the same degree of authority or control. He wrote, "The Laredo epidemic has shown conclusively to the minds I'm going to get rid of that. The Laredo epidemic has shown conclusively, to my mind, that results such as were obtained in Havana in the suppression of yellow fever during the American occupation cannot be obtained elsewhere where the disease is widely spread without the undisputed authority and the means that were at the command of the government of intervention in Cuba. These powers in reality amounted to martial law."